Well, spring is here. The season began yesterday, and while our kids are excited for warmer weather and more time to play outside, it also means dealing with springtime allergies and pollen. So here to tell us how to help our kids avoid those allergies, especially when they're playing sports outside, is Dr. Lauren Smith from CHKD. Appreciate you coming on.
Thanks
Lauren.
for having me.
All right, so the rain came through, so that's good news maybe for today, but that pollen's going to be back pretty fast.
Yeah, absolutely. You know, with the weather changes we've had this season, we're already, as you guys were saying earlier, starting to see the tree pollen out in high levels, and so we're seeing problems with our patients starting now, pretty much.
And in terms of pollen, why is it such a common allergen for kids?
I mean, it's common across the board for everyone, but certainly around age 2 to 3, some kids can start to develop seasonal allergies. And in this area, we tend to see the tree pollen starting in the springtime, but then it evolves into late spring and summer is the grass pollen, and then weed pollen is in the fall. So really, throughout the bulk of the year, they can get pollen exposures that cause issues.
And looking at some pictures of that right now, how can parents help their kids avoid a reaction to pollen?
Right, so there's no way to really prevent it if your kids are going to develop allergies. If you know that they do have symptoms, limiting playtime outside, potentially when the pollen's high. Certainly the biggest thing, because I am a big proponent of kids being outside to play, but at the end of the day, when the pollen counts are high, make sure they have a shower or bath before bed, you know, get everything cleaned up so they're not transferring that pollen to the pillow. Even if you're not washing their hair, try to wipe it down with a damp washcloth. And then if they still have significant issues, you know, potentially talking to either their pediatrician or an allergist about ways to help them manage that.
Good advice. And then what about for parents with kids who already have asthma, and then you factor in pollen as well?
Right, right. So for a lot of kids with their asthma, it is allergically triggered by the pollen season. So especially if there's a seasonality to it, if they're already on an asthma controller medicine, they need to stay on that and maintain it. If they feel like their symptoms flare up more during pollen season, again, parents should discuss that with their doctor or potentially ask for a referral to an allergist so we can do some testing and figure out what those trigger factors are for them.
And maybe for some of the newer parents out there, what age can you start to notice allergies in your children?
Typically 2 to 3 is the youngest. We'll start to see seasonal allergies to the pollen. Sometimes younger kids who are quite allergic can have allergies to more year-round things like dust mites or molds, which also can be big in this area.
All right. Dr. Lauren Smith, appreciate you coming on from CHKD.